Well, we're still vibing here at ViVE 2024, BP2 Health, Reverse Mullet Healthcare Podcast.
On the Road episode.
On the Road. I'm Dave Pavlik.
And I'm Ellen Brown. And we are here with Brent McDonald. And so Brent, tell us why you're here. Tell us about yourself.
Yeah, thank you. Thanks for letting me join you today. So I work for Vanderbilt University Medical Center. I'm Senior Vice President in Population Health, and we're here talking about value-based care and some new initiatives.
Which is our favorite, so I'm super excited that you're here. We had an episode recently where we said, why is it taking so long?
Yeah.
Value-based care, why is it taking so long?
Yeah, 10 years ago, we thought it was around the corner.
Well, I think that's when we met, was 10 years ago working on value-based care. So yeah, so tell us what you're doing at ViVE first.
Yeah, sure. So there was a press release this morning about a new partnership, or collaboration, I should say, between the network we built in Tennessee and Quantum Health.
Which is super exciting.
It is exciting, and it's the first of its kind in the nation. We're really looking at how their navigation services can align with our clinically integrated network to improve how we deliver care to the communities we serve, and we're really excited about that.
Cool. Any technology that's being leveraged there? Or?
Well, they have their own platforms,
yep.
And we, of course, have all of our capabilities to support the populations we take risk for.
Okay.
So what we're doing right now is figuring out how those two capabilities best align.
Okay.
But early indications are they align quite well.
Okay. All right. Perfect. So,
I forgot to ask you if you wanted to wear the mullet, the reverse mullet.
I think he's going to turn us down on the
okay.
props.
No, that's fine.
Those of you that are not able to see this on film, although I'm excited because we're going to get this on film, is I have the infamous health. The sponsor of this entire event, the infamous sequined jacket that has health emblazoned on the back. It's like the most outstanding sequin covered jacket ever.
I'm sporting the ViVE t-shirt.
Yes, you are.
From the swag table.
I guess I'm anchoring down with a little more conservative.
You look appropriate, and you have we all have our name tags. I feel sort of like when we were at JP Morgan a little, where it's like everyone's walking around the city with their name tags on.
So the question we're asking everybody is, what are you passionate about that you think can affect real, all caps, real change in healthcare?
Yeah, so we're 12 years into a journey of trying to do that. The reason I'm sticking it out in this is I really believe that the providers of healthcare are the ones that can make the most difference. We're the ones who are actually sitting in the room with the patients.
Absolutely.
Mm-hmm. And so all the work that we've been doing over the years to try to better align the providers of care, to get them more information, to get them what they need to do the very best job they can, we're really starting to see that work.
Really?
We are.
Okay.
And that's exciting for me, because in the end of the day, the patient gets a better outcome. And that's what we're here for.
Right.
Yeah.
Right.
And so we serve a population in Tennessee. We are committed to improving the care and the quality and the outcomes for that population. And the technology and the information and the incentives and everything are finally starting to turn to make that possible. Or I should say, enhance our ability to do that.
Do you think that anything has happened? Is it truly incremental? Because I always say to people, we created the podcast because I feel as an industry, we have very few platforms where we just have conversations about how we could really push the envelope on change, right?
Right.
But I always say I don't want to throw incremental change out with the bathwater, because that's the reality of the hard yards that we have to put in. But do you think that it's just been that it's kind of that tipping point where you've just, it's sort of like, what is it, the 10,000 hour rule or whatever, where we've doing it long enough that now it's starting to go well? Or do you think that there's just been a shift, any particular pivot that you think is making it feel a little bit more like it's happening, it's succeeding?
Yeah. So I think COVID impacted everybody. And what we see is the cost to deliver healthcare has gone up at such a fast rate.
Crazy.
That it's really going in ways passed through to the employer community. And that's not the right thing, right? The employers can't shoulder all that burden. So it's starting to force a conversation more from the employer side than it had been in the past, asking for help. And so what you're starting to see is organizations like ours across the country that are really trying to work directly with employers to figure out what can we do to make a difference for you. That can be primary care strategies, it can be a lot of different things.
Interesting.
But the real key is, how can we bring solutions to you as an employer that are specific to your employee population?
Population,
right?
Yeah.
Not just
Right, at
population,
large,
right?
exactly.
And that's where you start to see some real change.
And are you able to work? And see, I'm gonna have to stop because we only have 10 minutes,
Oh.
and this is clearly an episode that I want to have, and we'll even come to Nashville for that one. But
Well, welcome you.
Yes, but so
Love Nashville.
my last question is: when we talk about employers, we always talk about benefits.
Hmm.
So, or I should say, health plans, and then employers selecting benefits. And that's always been a big barrier for value-based care and for
Right.
provider engagement and for taking risks. So do you think that that is starting to shift? Like, are you all able to engage in that conversation around benefit design so that it really does support population health?
Yes.
Okay.
There are a couple parts to that answer.
Yes, there are.
First is, we'll work with anybody who wants to improve the care and the quality that is given to the populations we serve. And so any payer, any third-party administrator, any collaborator that can help us on that mission, we're there. We'll talk to them. The reason I'm here today, actually, is to talk about a new collaboration with navigation capabilities with Quantum Health. And Quantum Health, being one of the nation's
Wow.
leaders in
Okay.
navigation, we are a proven high-value network.
Yes.
They are a proven capable resource for navigating to care providers. What we've realized is the additive capability of what each of us brings to the table. So we
Interesting.
think the next step in that evolution is how do we work with the employers to incentivize their benefit plan
Exactly.
to do that very thing,
Yep.
right? And
Okay.
so that's where the providers of care can get closer to, I think, solving the challenge.
That's fantastic. Well,
Outstanding. So,
yay! Thank you. This
Thank
was
you so much
great.
for
We
stopping
really
by. Yeah,
appreciate you
appreciate
taking time. And now you have to go speak. So
Absolutely.
Well,
appreciate
thanks for
you
your
being
time.
here. Yeah,
Appreciate it.
thank you.
thanks for being here.
We'll see you in Nashville.
Yes.
sir.